support from the hospital and healthcare professionals. My 2 stoma nurses, Debbie and Julie, are wonderful. I mean, they're, real characters. And my gastro nurse, because I've never had remission, if I need something, then I'll email her and she'll email me back. I see a lot of them in clinic, and my surgeon is just wonderful, like Mr. Khan. I've actually named my guinea pig after him. I've got a lot of respect and a lot of time for Mr. Khan because obviously he saved my life. So have you had the same support from healthcare professionals as I have? Or?
I think that most people develop a really strong relationship with their surgeon or consultant because they're such a massive part of your life.
I know.
Definitely.
Yeah. Definitely. Well, I think when someone saved, actively gone out and saved your life, and it's hard to explain, you've just got this, awing respect for them.
Absolutely.
Yeah.
I just, wish I could do the same for him, but,
I think sometimes people aren't aware that there's that level of support out there.
Yeah.
And I've definitely heard a few people say to me, you get a stoma nurse, or there's an IBD specialised nurse. So I think that it's important that those people, all people with IBD, are told that there's that sort of support there, because it is there if you want to access it.
I know when I was first diagnosed, I had no idea. I didn't know anything about the disease. It were my stoma nurses that really brought me up to speed quite fast with it all, really.
Yeah.
I mean, they were great. Without them, I would have gone mental. I would have known how to cope with it. And like you say, you do strike up such a good relationship with them, your surgeons, even the nurses on the ward.
Yeah.
Without them, they do make the process so much easier.
The thing is, though, it changes depending on what area you're in, because I know some people don't even have access to an IBD nurse, and if you've got disease that never goes into remission, that level of support can be the difference between sinking with the disease and actually being able to live your life while still having the disease.
Yeah.
Yeah, I mean, I think as well, when I was first diagnosed, obviously it was 2007, so it was sort of the start-up of things like Facebook and everything else. So luckily for me, that I had never heard of ulcerative colitis. I was just given a file by the gastro at the time, and there's some information.
Read it.
Take it home, read it. Okay, great, what's ulcerative colitis? I had no idea. I didn't have a nurse at the time in the beginning. I was still quite young, I was at college. So it's a really difficult time in life because you don't really want to talk about it with anyone else. I didn't even want to tell my friends because who wants to talk about the bowels at the end of the day? And then obviously I've discovered that, Crohn's and Colitis UK, the website, and obviously went on the forum and started to speak to people, and I also realised obviously there was other people that were of the same age, even younger, that were going through it, and you kind of realise that you're not completely and totally isolated. And again, as you were saying earlier about stoma care, I mean, my nurses have been brilliant, and I still have a very strong relationship with both of them, even post-op. They'll come and see me, even though, I'll go out for coffee with them. That's the kind of relationship you have. And even with your surgeon, I mean, my surgeon, we're on Twitter, so we both on Twitter, he'll private message me and say, how are things? You just have that relationship. And as you say, you spend so much time with them that, in the end, they become friends as well as healthcare professionals. And that is important.
No, absolutely. My surgeon, Mr. Brown, is just fantastic and has always been a real support for me. And like you say, I can email him, and it's been fantastic. But I wanted, as soon as I got ill and as soon as I had the surgery and I started searching on the internet, I realised that although there was some, like the national charities, I couldn't find much of a personal opinion, and that's why I started my blog, So Badass, just because I couldn't find it out there, and it's what I wanted to read. And so I thought, right, if I share my story, maybe it'll be something that can... I always say I'd like to stop poo being taboo, because it, like you say, it's embarrassing to talk to your friends and family about it. But the more you do it, the more other people are a lot more open than you think they're going to be.
It's funny you say that, because obviously when I started doing some writing as well, yours was stop poo being the taboo, and obviously mine's breaking the taboo on poo, so it's obviously quite similar again. And obviously those sort of hashtags and those lines do, eventually they reach out.
Better, isn't it? I think there's a lot more support and a lot more people speaking out about it, and I think that can only be a positive thing.
Absolutely.
Yeah, yours was the first, one of the first blogs that I read, and then obviously going into the forums and everything, you do realise that a lot of people, are in the same position as you, and it's good in a way, because you're not as alone. Because healthcare professionals are good, but they can never understand unless they actually have the disease themselves, really.
Yeah, absolutely. And I think I always thought that, especially people with an ostomy bag, that it's an old person disease.
Definitely.
And that's something that people say to me all the
Think about
time.
your grandparents or
Yeah. And so
great aunt
to
and uncle.
be able to reach out to other people and everyone to understand that this happens to people of all ages
That's it,
is a really good thing.
Yeah.